Hi. Today I'll be opening up the operatory today. First thing I will do is turn on the lights, and then I'll come around, grab my dirty items, take them out, and then I'll go over to the dental unit, take that down, put it down, fix the cords if they're all tangled up, and then after that I'll have to wash my hands for a full minute. Take my hands, wash them, foam them, stuff for a whole full minute. As soon as I apply the soap onto my hands, that's when the minute will start. After that, dry my hands, done. Okay, now I'm clean. Clean items now. So I'm gonna turn on my dental unit, turn on, put the brake on, and this is my DA table for now. This is gonna be my back counter. Okay, so DA table has to turn it on, and put on the brake. That's on. Turn on my waters down here. Those are on now. Okay, and then afterwards, I'm gonna get my barriers. First, I'll get a barrier for the dental chair, and then a barrier for the dental unit. Put those on. Take one of the air water syringes out. Put it down here. Okay. After those things are on, also we'll have to turn on the vacuumator and curing light. Okay, after that I'll have to I'll get my barriers out for my air hoses and stuff, water hoses and suction hose and the HVE one, so I'll have to take those out. The barriers, 5 of those, one for the curing light. It should be 4, but I'm adding one for the curing light. And then, 5 of the twist ties, and then my attachments that attached onto the hoses. So 2 of the air water the attachments, and then the suction attachment, and then the HPU. Put that on. So first I'm going to do the dental unit. So take the hose, put it on, put my thumb in to press down on the button, put the attachment on there, then take the barrier, put it on, puncture a hole, also making sure that it doesn't fall out, or if there's any plastic on there. If there is, this patient can aspirate that, which would be not so good, Put a twist tie, put it back, and repeat for the next 3. That's on the DA table. After that, I think I got everything down for those. I'm gonna make sure the stuff is on the floor that they don't trip on, and I'll go get their form. So this right here is gonna be the patient's chart, records and everything. Put that right here. I'm gonna open it up, get the x-rays out, put them out right here. I'm gonna read over, see what they need and all that stuff. And then after that should be good. And then I'm gonna take out my tools that I will need. So I'm gonna retrieve a pen, calculator, and the thermometer. Well, I'm missing something else. What am I missing? Okay. Well, I gotta get the paper for the thermometer. Put it on. It's still in the case right now. Okay. And also the barrier. And if I also have to get the blood pressure cuffs. I don't have one right now, but I'm gonna pretend I'm gonna get that out. And also the stethoscope. Put that on for checking vitals. And then after that, I will go get my spray, which is right here. Sadly, the forks didn't fit in the Ziploc bag. Well, these are the tools that we need. Tray and the piece of paper. This will go on my DA table. Okay, so that's going to be there. We'll put it in here. Okay. After that, I don't open it yet. I will have to go wash my hands. Well, not wash my hands. I want to foam my hands for 30 seconds. I'll pretend the foam, and then I'm going to get the foam. I'm going to be pretending the foam, of course, for 30 whole seconds. And then after that, I can finally go back over here. This is where I'm going to organize, finally open up. Sterile, it's supposed to be sterile right now. Open it up. But I'm not even going to touch these. I'm just going to put them in there, throw this away, and then organize them, Let me be a little little scalpel thing, I think. Not scalpel. I mean a little hook thing, and then the cotton pliers. And then I should also have, let's see, I have another paper in here. This is gonna be the patient napkin. So this patient napkin kind of have a chain, click it on, you know, should be right over here, but I'm not gonna click it on yet. This, I'm just gonna place on top of the tools. And also I have to take out 2 of the gauze. So pretend to take those 2 out, get 2, you know, open one with one hand, get 2 others, place them down. Okay, that's it. And then with this hand, I'm gonna get my PPE, which will be 2 gloves, which will go on top of this napkin over here. 2 gloves, and my glasses. Well, let me take you here. Well, of course, you know, we'll have mask on and everything, as always now. And I think that will be it for getting our room ready. Got everything. Now we'll have to go inform the doctor. I'm not the doctor. Okay, after I seated my patient, I will go to the dentist, which in this case is Dr. Wolfels, right here, and tell them about their vital signs and if they're all good. And then after that, I'll also tell them what we're doing, what procedure we're doing. In this case, we're doing composite filling on tooth number 4, and also the patient name, which is Brianna Rodriguez. And tell them that she's ready for us, and that he'll hopefully say back, be there in a bit. Grab my mask, put it on, make sure to pinch, grab my glasses, put them on, foam in my right hand. Foam, come over here. I'll have my stool right here where I will have to position it and put it right here with my knees facing the wall. Okay, this is when I will foam for 30 whole seconds, okay? After the 30 seconds are up, that's when I will put on my gloves. Okay. And be ready for the doctor to come in. Okay. After that, procedure complete. Ready, Brianna Rodriguez?
Yes.
Hi. Hey, would you come with me? Take that back over here. Ready? If you won't mind sitting down right here today, I'm going to close this for you and have you sit here, okay? Alrighty, so how are you today?
I'm good.
Alright, that's good. Well, my name is Yamilet Ariana Rodriguez. I'm a dental assisting student at MCC, and I'll be working with Dr. Wolf today. Is that okay?
Yes.
Alrighty. So you mentioned that you feel okay today. Has your family been sick?
No.
Really? No? Nothing?
No.
Nothing unusual? Okay, well that's great. Well, I'm going to go over couple little things with you today on your medical history.
Mm-hmm.
It says here that you have some sinuses sometimes. Is that acting up today by chance?
Not today.
Not today. Okay, that was better than normal. Pretty good.
Yes.
Alrighty. It says here that you're taking any medication right now.
No.
That's great. Okay. Well, that's good. Alright, let me sign that. No changes. I'm gonna need you to sign this for me. Just to clarify that if you work. Oh, your own pen.
Yes.
Not restricted. Okay, and now we're gonna go over your dental information today. So it says here that, let's see. Usually, like, your teeth are usually like sensitive to cold and hot stuff. How's that right now? Like when you drink coffee, do you have any sensitivity? Has it gotten better? You think, like,
yes.
Does it
happen? It's not that sensitive. It's normal.
Okay.
Like normal teeth.
Usual. Okay. Let's see. It says here that you want to get your teeth whitened too.
Yes, they're very yellow.
Oh, okay, well, put that in for the dentist. Alright, so really nothing has really changed. I'm gonna put no changes. I'm gonna need you to initial again right here for you. Okay, here you go. It's right hand this time. Thank you. Ready? Just right here. Here. Okay, after I start with that, I'm gonna get I'm gonna wash my hands. I'm gonna wash my hands for 2 minutes now. Okay. So, how is your weekend going right now?
It's nice.
Nice. That's great. Do you have any plans?
Work.
Aw. Where do you work at?
I work in a fast food place.
Oh, cool. Oh, what do you do?
I make a milkshake.
It's great. That's great. Milkshakes are so good. My favorite one is the watermelon.
They're high in
Milkshake.
sugar. I don't think you should recommend those to me.
I know, they're pretty good, but it's never good to, little's great, but not too much,
How much is too much?
Well, until, how you said you have that sensitivity to, yeah.
I can build an immunity.
You're right. Thank you. Like that. Okay.
Welcome.
Well, that's ready now. Okay, and let's see now. I'm gonna check your vitals now, okay? So, can I see your pulse, please? Okay. I'm gonna do that. Would you like me to use this hand or this? Okay. Here. Okay. Did that for 30 seconds, so I'm gonna double it, and then I'm gonna add 40 to get my top number for the blood pressure. That's when I take my calculator and I do all that. Okay, and on the red paper, I'm gonna put her down. Okay, so let's see. Nope. Right over here. So pulse was 70, pretty good. And now, check your temperature too. Go, can you open up for me, please? Right, close. Okay. Beep. Okay. Ready, 97.8. It's pretty good right now. Okay. See? Okay. And while I did that, I also checked how she was breathing. Okay. You don't know, of course, that you don't know that. And now I'm gonna check your blood pressure. That's when I take my imaginary thing, and then also the blood pressure. Go. Do you know which arm would you want me to use? This one? Okay. Put it around. Okay, is that okay, Lenny?
A little tight.
Oh, okay. Just there we go. Okay, and now we're gonna put it like this. And I'm gonna check for it. Okay. I'm gonna hold it like this, the thing, so my heartbeat doesn't interfere with it. Okay. I'm gonna do the pump. Okay. Take that off. Okay. Here you go. Put it right there. Fine. Okay. So your blood pressure was 120/80, which is good. That's very good, Okay. And since I took them all, I'm gonna have to write my initials and date it on the chart. Okay. So, and I also discussed her vitals with her while I was doing them, telling them that they were very good right now. Great. Okay. And today, our plan for today is to do a composite filling on tooth number 4, which is your second premolar. And we're basically going to fill it in, for you.
Yeah.
And let's see. Right now, I'm going to put the napkin on you. Well, I think my napkin disappeared. Wait. I'm just going to pretend this one, it should be another napkin here. But, okay. So, I'm going to put it on you. Wait a minute. Oh my god, I'm a klutz. Sorry. The napkin is on the tray. Yeah, okay. Take this. This should be behind her so she doesn't get flipped out. But I'm going to take this. So, I'm going to put this napkin on you, okay? Okay, I'm gonna put this on you right here. Okay, you don't mind. The chain may be a little cold. Can you lean forward a little, please? Right, here you go. You can adjust it like that. Okay. And now, let's see. I'm gonna adjust your chair, which is on the other side. Do that for me. Okay, tell me if you feel wheezy when you're ball going down, okay? Feeling okay? You fine?
Yeah.
Alrighty. Okay. Okay. Over here. Let's see. Snapping. Ready. Now, I'm gonna adjust, let's see, in that position, okay? I'm gonna turn on the light, sorry about that. I'm gonna point it at her chest. The light is gonna point at her chest. And after that, I'm gonna be going to go fold my hands, get my gloves and everything. Let's see. Well, first I gotta go inform the doctor. Okay, which would be, let's see. We'll go to the doctor. Now we'll be dismissing the patient. Alrighty. Okay, I'm gonna check inside your mouth real quick. Okay, everything seems good. I don't see anything and I don't feel anything. That's good. I'm gonna take the air water hose and also the suction. Suction a little bit out. Okay, is that enough? Do you want more water, suction? Alright, put that back. And after this, then take one of the gauze, spray it down a little bit, and touch her up. Because, you know, after all that, she'll have stuff that she doesn't want on her face. Okay, here you go. Take that, put that back over here. Then I will lower and also set her back up. Okay, I'm gonna sit you back up, please. Okay, are you feeling okay?
Yeah.
Okay. Ready? How are you feeling?
Good.
Good. Okay. Ready? Now I'm gonna take this off for you, the napkin. Okay. Keep moving your head up a little, please. Alright, thank you. Cover this with the tools because I don't want you seeing all that. Ready? And then after that, I'm gonna open up her chair. Okay, I'll open this thing up, but please stay seated and we still have to go through some paperwork, okay? And then after this, with my dirty gloves still on, this is when I will take off my glasses. Put them right here for now. My glasses, and then remove my gloves. Oh, twist it harder. One pinky. Okay, and I'll throw those away, of course. And these are going to be on the table and then I'll go over there, foam for 30 seconds. After I foam for 30 seconds, I will use the pinky method. Take the mask off like this and dispose of it. Okay, then after that, I will then wash my whole hands for a whole minute. Right now I'm going to pretend over here. I'm doing all that. Okay. Well, of course, after I wash my hands, I will disinfect my glasses with the spray. I take a napkin. Take a napkin, put it on the spray bottle, and spray all over, okay? And then wash my hands. Okay. And then, to that, I'll come around, we'll repeat the